Eye irrigation is the flushing of eye exudates, including eye solutions, foreign particles, dust, or fibers out from the eye or eye socket. There are four main purposes of eye irrigation. Number one, it is used to reduce contamination of the eyes from chemicals or irritating substances. Second, it is used to reduce the discomfort and minimizes corneal damage. Third, eye irrigation is also done to prevent infection of the eye. And fourth is that it is used to promote visual acuity. For the assessment, the expected behaviors are the following. Number one, we need to check or review the doctor's orders systematically, including the solution that we will be instilling in the affected eye to receive irrigation, because this is used for accuracy of the amount of the solution for effective procedure. Second, we also have to assess for the reason for eye irrigation. This is done to be able to establish baseline data and for you to know your limits or the extent of the procedure. Third is that if there is enough time, we have to do, or we can also do, an eye examination, in which this includes the determining of perla, pupils equally round and reactive to light, and accommodation. The patient must display perla to ensure that there will be no abnormal findings prior to the procedure. Then we have to assess the eye if there are signs of redness, tearing, discharges and swelling. And we have to ask the patient if he or she is experiencing itching, burning pain, blurred vision, or photophobia. Now, these are the signs that are present if inflammation or foreign object is found in the eyes. Next, we also have to ask the patient to rate the level of pain using the pain scale of 0 to 10, 0 being the least painful and 10 as the most painful. If pain is still persisting, we need to refer it immediately to the doctor so that the medication can be given to the patient. And also, we have to assess our patient's level of consciousness and ability to cooperate. That is to know if the patient can be able to follow our instructions or commands and to gain cooperation. As part of our assessment, we have to gather and prepare all the materials that we need in this procedure, including the solution. We have to make sure that the solution or the fluid is at a room temperature. This is to save time and effort. The materials that we need for this procedure are the following. We're going to need a bath towel or an underpad. We're going to also need a prescribed irrigating solution, sterile normal saline or tap water, soft bulb, syringe or eyedropper, sterile basin, emesis basin, 4x4 sterile gauze pack or cotton balls, clean gloves, examination light or drop light. Then we also have to identify the patient. That's to make sure that we have the right procedure is being done to the right patient. Along with that, we have to also discuss the procedure with our patient in order for us to gain the cooperation and to lessen our client's anxiety. We have to disclose here whether the irrigation is done for the patient to regain vision, to reduce the pain that he or she is feeling, or to make her feel comfortable. Good morning, ma'am. My name is Jelly and I'll be your nurse for today. May I have your complete name and your date of birth? Okay, so Sheila Suarez, 11/28/1957. Great. Now, Ma'am Sheila, today your doctor has ordered to give you an eye irrigation. Eye irrigation is the process where we are going to clean your eyes using our solution here. And that's to make you feel comfortable and to remove all that dirt from your eyes. Okay? In this procedure, it will be just a little bit uncomfortable, but don't worry because I will be right here with you, and if you think that it is so unbearable already, you can always let me know, okay? And so we can take a break. All right. Do you have any questions about the procedure? None. Okay. For the implementation, prior to doing the procedure, we must always ensure that we do hand washing. As for infection control or to deter the spread of microorganisms. Next is we have to don clean gloves. Donning gloves is very important for infection control and to deter the spread of microorganisms. After donning clean gloves, we have to make sure that we also remove any contact lenses from our patient if he or she is wearing it. Now, having contact lens while doing the procedure might cause an infection. Ms. Suarez, are you wearing any contact lenses right now? Oh, okay. Now I'm going to need you to remove it for me because to do the eye irrigation procedure, we must remove the contact lens since it will just create an infection. Thank you. So after that, what we're going to do is we're going to position our patient in a supine position with his or her head tilted to the side of the affected or infected eyes. That's to prevent the solution from spilling. So here we have Mrs. Suarez. We position her in a supine position with the head tilted to the side of the infected eye. Her infected eye is the right side, so we're going to tilt it that way. Now the reason for that is to prevent the solution from spilling. Also, we have to position our examination light focus to the infected eye in order for us to see clearly or to have proper visualization of the infected eye. Then, we need to also remember that we have to place an underpad or towel on the bed in order to prevent the bed from soiling. The next step that we are going to do is we're going to place a towel just below the patient's face and the emesis basin just below the patient's cheek. This will catch the solution in foreign body being irrigated. Placing the towel below the patient's face and also the emesis basin below the patient's cheek is so important because this will catch the solution in foreign body being irrigated. So the next step is that we're going to clean the patient's lids and lashes using a gauze or cotton ball, making sure it's moistened, and then we're going to wipe from inner to outer canthus. The reason is that it is done to avoid irritation and cause contamination. Then after that, we're going to retract the eyelids gently by pulling the upper eyelids toward the eyebrow and pull the lower lid down towards cheeks. Hold open by applying pressure to orbit, not to the eyeball. The reason for this is we're going to expose the area and have a clearer vision on the patient's eyes and the surrounding area. The next thing that we're going to do is we're going to fill the irrigation syringe with fluid, and we're going to be asking the patient to look downward. In order to expose the sclera, we have to ask the patient to look downward so we can achieve better cleaning. Now, since here we're using an asepto syringe, we're going to first fill our irrigation fluid into a sterile cup. So now we can proceed with the filling of this asepto syringe with the solution. So here what we're going to do is we're going to hold the irrigation syringe for about half or an inch above and away from our patient's eye, and we have to gently irrigate the solution from inner to outer canthus. This is to administer the solution slowly and to remove the particles properly. Then we are going to redo the irrigation until we will be able to achieve the desired result or the total amount of solution has been used. Allow the patient to close eyes between washings, especially if there will be a large amount of solution that is required. Now, doing that will enable the patient to feel comfortable while doing the procedure, so by allowing her to rest for a little bit. So let's go ahead. Ms. Suarez, I'm going to need you to look down, okay? We have to expose your sclera so we can clean better. Okay, so I'm going to start now, irrigating it from inner canthus to to outer hinges. Inner to outer, inner to outer, inner to outer. Thank you so much, Miss Suarez. Now, okay, we can take a little bit of a break. You can close your eyes, open and close them, so to let you to rest or to relax a bit. Okay, so start again. Well done, Miss Laras. We are now finished irrigating your eye. What I will do is that we're just going to remove the excess moisture in the area or the surrounding area by blotting. This will let the patient feel comfortable and be able to see clearly. After blotting the area dry, what we will do is we are going to do aftercare. We're going to tidy the area, dispose the soiled supplies, remove our gloves, and perform hand washing. That's to avoid cross-contamination. For the evaluation, number one, we have to observe for verbal and nonverbal signs during the irrigation. The reason is because it could be a basis for patients' comfort or anxiety level. Then we also have to assess for patients' comfort level after irrigation. So that's to determine the effectivity of the procedure. And then we also have to inspect the eye for normal signs or any abnormalities. That is to ensure that there will be no complications or done after the procedure. And lastly, what we have to do is to ask the patient about improved visual acuity. That's to know if the procedure is successful. Ms. Suarez, do you feel or do you think that you could see better? Do you feel more comfortable than before the irrigation? Oh, that's good. Okay. For the documentation, what we will have to do is to record in the nurse's notes the condition of the eye of our patient, and also we have to report if there's any pain and other visual symptoms like if there's redness, there's itchiness, and a whole lot more. Then we also have to record the amount and type of irrigation used. And lastly, we have to report if symptoms of pain and blurred vision persist.